All right, so I am going to turn it over to Paul. And Paul, I apologize. I didn't ask you if you needed to share your screen for anything, or if you just want to talk and then you let me know what works best for you.
Yeah, I could just talk for a little bit. I'll give a rundown of what we do, the programs that we offer at our agency, and how we're looking to get involved with Cortland and Tompkins County. And then I'll leave it open for any questions that anybody might have. So that totally works for me.
Perfect. Okay, great. I'll let you, I know you sent me a little introduction, but I'll let you just kind of jump into it as long as you're telling us about yourself and the organization. You can probably do a better job introducing that.
Sure, no problem. So, hello everyone. It's nice to meet with you all today. My name is Paul Muso. I'm an occupational therapist and the program coordinator for the Center for Aging Resources and Enrichment. It's a big long name, so it's called CARE for short. We're a nonprofit organization affiliated with Lemoyne College. For the past 3 years, we've been implementing this fall prevention program, our evidence-informed program, designed by myself and a couple other occupational therapy colleagues that I have. And we've had really, really good results in Onondaga County. And we're hoping to kind of knock on the doors, and expansion has always been high on our agenda. And I was lucky enough I've had a good relationship with Anthony Scalise over at Upstate for a while. Him and I share the same passion for all these fall-related injuries and trying to get ahead of them and be more proactive about it. And the study that they did, I don't know if anybody has had a chance to see the data, but it's pretty startling, the numbers of falls that we have in upstate New York, particularly in Tompkins, Cortland, and Onondaga County is number 3. So a little rundown of who we are. So we're grant funded. We're a grant funded nonprofit agency. And our primary funding source for the last several years has been a grant from the Office for Aging in Onondaga County. So that's the reason that we've been constricted and a little bit confined to Onondaga County. We're a very small organization and constantly, looking to get into some of these other counties. So I'll just dive into what our typical fall prevention program looks like. And then I'll talk about some of the newer programs that we've established too, all in the hopes of helping older adults age gracefully, independently, and hopefully in place as well. So our typical fall prevention program is a 7-week model. We collect pre and post assessments using standardized assessment tools. And with that occupational therapy focus, we really identify a lot of the risk factors that could lead to falls during activities of daily living or ADLs, which I'm sure a lot of you are aware of. So we cover biological, behavioral, and environmental risk factors. During people's day-to-day activities, we have different weekly topics in which we go through those 3 different categories of risk factors. How can we modify some of our activities? How can we modify the way we're going about our ADLs so that we're doing them a little bit safer, a little bit more efficiently for our bodies, and also mitigating a lot of the fall risks that we know a lot of seniors, they get stuck in their ways and they've been doing their same activities and routines for so long, they don't realize how much they're putting themselves at risk by just doing simple things around the home and out in the community. So I'll give you the weekly topics. So each week, like I said, different weekly topics. So week 1, or the week 2, really, the first week of content for the program, we cover the bathroom, all the different ADLs that go into bathing, dressing, grooming, hygiene, everything, all those nighttime bathroom trips where statistically we see the most amount of falls typically occurs, those nighttime bathroom trips. And we go over all the different strategies of how to eliminate some of those potential risks that could, promote somebody to suffer a fall. Week 3, we cover the kitchen or dining areas, anywhere folks congregate for meals. Week 4 is community mobility, which is a big one. Obviously, this time of year, we cover all the weather conditions, when you're leaving your home, going out any place in public, all of the risk factors that could lead to a fall, stepping up on curbs, stair navigation, how to properly size and use your assistive devices. We see so many seniors, and I'm sure you folks do too, that might have a cane or a rollator or a walker, but it's not properly sized for them. They don't properly use it correctly. So they're really putting themselves at risk even by using a device incorrectly. So that's a big area of content as well. In week 5, we cover sleep, how to get proper sleep, what that does for our bodies, how to have proper sleep hygiene, how to set ourselves up to promote better rest so that we have higher energy levels, attention levels, throughout the day. That really has a huge impact on our ADLs as well. And then week 6, we cover fall safety and fall recovery. So in the event of a fall, how do we safely protect ourselves to the best of our ability? How do we prevent those really devastating injuries, hip fracture, TBI, and how do we safely get up off the ground? How do we call for help? Things of that nature. So Oh, those are the weekly topics in a nutshell. Week 1 and week 7, we collect our pre and post data. So we give a little overview, we do a little review at the end. And the data that we've gotten has been really, really, beneficial, and it's really rewarding to see, honestly. So I'll just give a couple of our statistics. So this was in 2025. And again, we've been running this program for about 3 years in Onondaga County. Each year has gotten a little bit bigger, which is, what we're really looking for. But in terms of participants that are high risk pre-education, so week 1, we see 73% of the people that we work with are high risk for suffering a fall. And that's a combination of our 4 standardized assessment tools. Our post-education, so participants that have completed the program, in its entirety, in week 7, we see that number 73% at high risk drop to 42%. Our participants with a high fear of falling, so that's a really big part of what we do too, is that we address that fear, that confidence, that lack of confidence rather, that people have. Maybe they've had close calls, maybe they've had falls. A lot of people get in this perpetual fall cycle that we cover as well, where they start to isolate themselves, they start to avoid a lot of their daily activities. So we really we want to make people feel more confident and still be able to engage in all the things that are meaningful for them to do. So high fear pre-education, we see 38% of people, and then post-education, we see that number drop down to 23%. And then we have folks whose leg strength have increased from our balance exercises. We see people have completed the program, we see an 80% overall increase in their leg strength. So I forgot to mention the exercise component, which is crucial for our program as well. So I mentioned all those topics, all the education, the risk factors. So the first half of each program is about an hour long, once a week for 7 weeks. We cover the education, which is all those risk factors, and then the second half of the class, we have an exercise component to our program as well. We've had occupational therapists and certified yoga instructors and Pilates instructors all collaborate to form this exercise program that we have. So we do a combination of chair yoga, Tai Chi, and resistance band strength training exercises as well. So people are getting a little bit of both, the educational component and that exercise component that we try to make as accessible as possible for people. So that is the fall prevention program in a nutshell. I know it's probably a lot of information. I get really excited when I'm talking about this stuff, so I could leave some stuff out, but I want to open it up to if anybody has any specific questions on the fall prevention program itself before I dive into a couple of our other newer programs that we've developed. Okay, if there's no other questions or if anybody thinks of something, just let me know. So based on all of the results and the feedback that we've gotten from our fall prevention program the past couple of years, we've noticed a couple trends. We have a lot of caregivers attending our programs on behalf of a loved one that maybe can't go to a community center or a senior center or a library or a church, or maybe, we run our programs in a variety of facilities. We have like 35 different facilities within Onondaga County that we've been running our program at for the last couple of years. But we see a lot of caregivers wanting some of this information because maybe they have a stubborn parent or a stubborn loved one or somebody that just can't attend the program or maybe just doesn't really want to, go to that community-based type of model. So that gave us the idea to promote a caregiver training workshop as well. So we do have caregivers attending our programs, the fall prevention programs, but we designed a one-day 90-minute workshop specifically tailored towards caregivers to equip them with, the essential skills that people need to care for a loved one. I'm sure anybody that works with caregivers, or maybe you're a caregiver yourself, it's very daunting when you're first starting it. There's a lot of confusion, there's a lot of angst. Could be a really overwhelming process for a lot of folks. So we're hoping to just mitigate how scary and overwhelming that can feel and give people the real skills that they need. So this one-day workshop is designed for both professional caregivers, so CNAs, patient care techs, any other type of aides, people that might professionally be working with folks in long-term care facilities. And it's also for private caregivers, so anybody that's just looking to receive some information to help their loved ones. So we cover a variety of caregiving techniques, including fall prevention strategies, how to set up the home for success, how to make all of our activities a little bit easier to manage for both the caregiver and the person that they're working with. We teach people how to conduct their own home safety assessments. We'll walk them through how to actually go through the home using specific tools and just be able to identify for themselves, what risks might be apparent in the home. We also cover how to do proper body mechanics during transfers. Especially during, getting people in and out of the shower, in and out of the tub, in and out of bed, on and off the toilet. We've had a lot of feedback from participants of our fall prevention program, that live in maybe an assisted living or a long-term care facility that say sometimes the scariest part of their day is when their tech or their aide is getting them in and out of the shower or on and off the toilet, things of that nature. We feel like a lot of people just aren't properly trained these days, or maybe there's just a lack of continuing education for that. So that's something we'd like to address as well. And we also offer hands-on training opportunities. So hands-on practice with these transfers from the occupational therapists that are there doing the program, going over those assistive devices again, sizing them, using them correctly, weight transfers, things of that nature. So that's a one-day workshop. And we also, the last one-day workshop that we have right now is a nutrition workshop. So one of our occupational therapists is also a certified senior nutrition specialist. So she has developed this holistic, comprehensive course designed to meet the specific needs of older adults with a focus on disease management, prevention, and also really managing those chronic conditions. So she goes over different things of how inflammation perpetuates some of these effects, different self-screening tools that you can use when you're identifying different parts of your nutritional plan that you're trying to incorporate and to improve on. She covers macronutrients, so how to properly look at nutrition labels. Maybe you have diabetes or, heart conditions or hypertension, things that we should really have more of a sound awareness of when we're reading nutrition labels and going out to the store and, trying to come up with recipes and things of that nature that is going to positively affect our health. And she also covers how to guide people for healthier cooking options at home that are budget friendly, some adaptations for recipes and diet, based on different dietary restrictions that you have. So those are all, in a nutshell, kind of what we do, services we offer, services we've been offering in Onondaga County. Like I said before, I was lucky enough to meet Karen yesterday with Anthony, and we said, wow, this is exactly what we've been looking for to get to Tompkins, to get to Cortland, to get to some of these neighboring counties. And Anthony's role is really the data person. Like he's done an awesome job with that comprehensive study that Upstate has done in responding to all these fall-related injuries, because Upstate, I know, is so overwhelmed, and I'm sure some of these other counties are as well. With people falling down, it's really spreading emergency services thin. I could go on a whole soapbox about all the costs, Medicaid, Medicare, the costs associated with falls, but I'm sure you're all very aware of that. So a big area that we've been looking for is to get into some of these other counties, and we feel like this is a great opportunity to knock on the door and network with people and hopefully get something to happen, because Onondaga County is pretty bad itself, but Tompkins and Cortland you guys have us beat, unfortunately. So it's not really a number that any of us want to brag about. We want to be proactive and get those numbers down to the best of our abilities. And a big goal of, a big focus of what we do with all of our programs is trying to be proactive rather than reactive. Falls are really hard to be reactive for because it can be such a life-changing event for so many people involved. So the more proactive we can be, the better. And I'll open it up again to any questions or any other information anybody might be looking for or might need.
I definitely think it's amazing that you and Anthony are both looking to collaborate at this time, as well as one of the reasons too we wanted to come today was to get us a little stimulated to think about the things that we can do. And one of the things that Anthony and Paul talked about yesterday in the meeting is also being a great resource to help us look at if we find something like this that we'd like to do to help write grants, figure out a way to fund these initiatives. And so I know myself, I'm really excited to be able to offer both you and Anthony as resources to both of these groups that are going to be taking on the falls prevention, as well as looking at things in the discharge and transition processes and along those ways, because some of the programs that you offer, I think, really go along nicely with that. Just so everybody knows, as well as since we had things already planned for today, that's why I said to Paul, can you just do a short abbreviated thing? But Nicole's going to work with Paul on getting him to come in March to do a community conversation more around the more comprehensive programming that you're doing. So we will have the opportunity to do that, as well as both Paul and Anthony have volunteered to be helpful if we need to present to stakeholders. So if we need to go and pitch why we need support around these areas. They can help for, the data like Anthony has, but also Paul can help with what's been really successful in Onondaga community or Onondaga County so far.
Yeah, and we've worked with, I'm thinking now, in the last 3 years, we've worked with over 1,000 seniors in Onondaga County that have, attended our programs. We have good partnerships with about 35 to 40 different facilities. And we have so many requests from people, from Ithaca, from Portland, from Madison County, from Oswego, all these different places. For the last couple of years, they're saying, when we go to marketing events or table events, senior fairs, things like that, they're saying, well, can we get this program here? We really need this here. And I'm like, I know. It's just the funding is obviously always a constraint for, a lot of people in this field. So we have private pay options. We have, grant funding would be phenomenal. So we do have different prices for each program that we feel we try to make it as economical as possible for folks. So if anybody needs any of that information, I'd be happy to share those as well. But yeah, that's just the primary constraint we had, unfortunately, is just being confined to Onondaga County. They've been very supportive of us, which is great. But it doesn't help us cover, the large scale of central New York, which is what we're looking for.
Anyone have any questions or thoughts for Paul? I guess if not, then we will definitely be in touch, Paul, to follow up with getting you connected with our groups and also as we're progressing through getting our work groups up and going. I'm sure we'll have more to be looking for to collaborate. Thank you so much for taking your time today. And Paul was great because we literally were talking yesterday afternoon and just said, "Hey, are you available tomorrow?" So I do appreciate you just doing it on the fly for us. Thank you so much. And I did put you in, oh, go ahead.
Karen, could I ask a quick question? This is Jessica Taves. Hi, Paul. Thank you. I'm a fellow OT down here at Ithaca College, so this is ringing very true. Several years here in Tompkins County, we did the Step Up to Falls, I think, program through a grant. If anybody on here, maybe Lisa,
Yes.
right? Yeah, was it Step Up
Yes.
to Falls? We followed that program.
Mhm.
I believe. Anyways, I think
Yes.
that we are very interested. I feel like at that time we kind of saturated the community for that time being. And we are definitely looking to increase the fall preventions. I was just talking with a couple of physical therapists. We've got somebody down in Binghamton. I don't know. Paul, have you had any communications with anybody down? Is that Broome County?
Nothing that's been concrete or, kind of sustained, maybe just casual, networking conversations, but it hasn't really transpired into anything more than that.
Okay, great. Because I think what we're going to do is I told them I would gather information from here and maybe reach out to you next week to kind of see how it works with the university aspect of it and workload, if you'd be willing to chat with that. But we do know that there is initiative happening down in Broome County in which they are actually doing a mobile session. And so they actually have a van where they go out to places and are working with people on doing fall prevention and identifying falls and barriers and home safety evals for more rural. And that is something that I think we are also going to be kind of looking at and just kind of gathering all this information to see what would be best for Tompkins County, or at least for the Ithaca College connection. And we would love to collaborate with the community, obviously, but those are two different things that we're kind of looking at that we would love to speak more with you about, just because you've also got the college connection that would love to see how you're working that. So if anybody has that connection, we're having a PT reach out to Sue O'Brien down in Binghamton and what program they're using and what funding they're using and seeing what that looks like. So I'll be in touch, Paul.
Yeah,
I would
thank you
just
for
like
sharing
to,
that. Oh, I'm sorry. I just wanted to chime in on that just
go
because
ahead.
so I'm an alumni of the Lemoyne OT program, and we still have a great relationship with them. We actually take their students on as a level 1 and level 2 fieldwork opportunity to attend some of our programs. So I was talking to Karen about this yesterday, actually. I think it'd be great if, Ithaca and Lemoyne kind of just did some type of
Mhm.
collaboration with this kind of focus in mind. So I just wanted to throw that out to you, Jessica. Sorry, Lisa.
No, that's totally fine. Hi, thank you, Paul. I'm the director at the Tompkins County Office for the Aging, and thanks, Jessica. Yeah, so we were very involved with the Step Up to Stop Falls, but it was grant based. There's a lot of work that's done. Nicole was has all the data that we have too, from when the Human Services Coalition was involved with that too. So there's a lot of work that's been done in the community. But after the grant ended, a lot of things, leadership changed. It kind of just all fizzled out a little bit, even though the need was still there. One of the things that we still do in our office is the home safety assessments. So we still do those for people for free in the community. But that's the capacity that we have. We need so much more. We need some of this work done broadly through not just our office, but through all our systems. And so this is amazing. I'm super happy that this is like starting back up and getting revived because it's really important.
Yeah, the numbers unfortunately have only increased in terms of
Yeah.
people falling down, especially this post-COVID era. The CDC is even having a hard time coming up with all, up-to-date data because it's just so overwhelming. And New York State is number 4 in the entire country for falls, behind, the big states like California, Texas, Florida, and upstate New York. Unfortunately, we're right near the top of that list too. So it's just something, it's a big area of need. Unfortunately, there's just such a scarcity across the
Mhm.
state of different evidence-based models that just have enough traction and the sustainability to keep them going long term. And we're a very
Mhm.
small agency, but that's why it'd be so awesome for us to be able to get into some of these other counties, because we would love to be able to train other people to implement them and just kind of
Yes.
get more boots on the ground, so we can spread ourselves out a little bit more. But this is just it's been high on our priority list, so I'm just so happy to be having these conversations with you folks
Yeah.
right now. So it's been a big area of need for us for sure.
Awesome. Thank you.
Thank you. Okay, so we'll be in touch, Paul. I'm sure a lot of us are excited about this collaboration, so thank you so much.
Thank you all. I really appreciate it, and I look forward to being in touch with some of you and seeing where we can take this for sure.
Sounds great. And I did put your webpage in the chat, and then I'll send out the information in the notes to the group with more links to your organization.
Sure, and feel free to email me, call me if anybody has any questions or wants any more information. I'm always available.
Sounds great. Thank you so much.
Thank you all. Take care.
Bye. So I did pull some of the information from the Step Up to Stop Falls. That's what it was called. And just in the document that I just linked for the Falls Prevention Breakout Group, I did put what the goals were back then and some of the projects that people were working on, just for discussion about what's still going well, what may have fallen to the side, and what is the group, do you know what I mean? Can we pick up easily to kind of adjust or to start with? So I just wanted to let you know I did pull some of that information out of there. Let's see. So my thought was to break our group into 2 groups to discuss basically what some of the area priorities might be, what you might need in line of what data do you need to support, what people do you need around the table that you want to do. And then the biggest thing that I need to put out to both groups is that my role here is to support you, and I can find ways to help with scheduling the meetings, helping in any way I can to help get connected with the data, those type of things. But I really do need the group to pick somebody, 1 or 2 people who are willing to somewhat be like the facilitator, or I don't know if the word chair is the right word. Basically, somebody who's taken a leadership role to report back quarterly on what the group's been doing. I just don't have the capacity in my to be able to run each group, so to speak. So I do need help along those lines. So you might have to arm wrestle over it, but it really is just looking for somebody to be able to communicate with me what you guys need. Also be the person who's going to report back at the quarterly reports or tag team with that. Any questions on those two areas or what we're looking at? I thought we would break out into the groups. There's the Google Doc kind of tells you 6 questions that we're looking for you to answer. And then, of course, you can put any questions or things, concerns that you have on that doc as well, that I can then look over. Thoughts or concerns before we break out into those groups or any discussion items?
I just wanted to ask, how often do you want these groups to meet per quarter?
The I think probably monthly is a
Okay,
reasonable thing. The thing that we've talked about in the past is without regular meetings, things kind of slide and they're hard to keep on top of. Obviously, if somebody can't make it, I think it's fine to check in with other ways to do it, but I think trying to get back onto a regular schedule would be good.
yeah,
Our hope is monthly,
okay, all right, cool.
but I think the group will dictate how often they need to meet. And we'll be, once we get this started, I'll be also reaching out to work with the group to talk about, what are some tangible goals? What are some things that we can, because we want to be successful and not just keep talking about the same things. And so we want to have the ability to have some concrete things that we're working on and doing, as well as setting goals and maybe looking at, are there, grants down the road or different things that we need to support that.
Erin, you're muted.
Thank you. The dog was hacking up something again, so I muted it because it's awful for me to listen to it on this end. I don't want anyone to have to listen to it either. If there isn't any questions or anything, I will break out. I'll create 2 rooms. The first room, room 1, will be for people who would like to do the falls prevention, people who would like to work on discharge and transition processes can go to room 2. And if there's any issues along with bugs or anything, let me know and I will try to intervene. I will be popping between both groups. Okay.
Karen, I was
Yep.
going to add, maybe if people are interested in both, maybe wait a second and see where people are going and maybe go to the one that doesn't have as many people. So because maybe if everyone's really interested, but they all go to falls, we want to try to have some balance. So if you're interested in both, maybe hang on and see where we need more people to be directed.
Good point. Thanks, Nicole, for that. Okay, so I open the rooms. Should be able to select those. Is that coming up for you to choose? Okay.
And which one is falls, number 1 or number 2?
Falls is number 1.
Okay, thank you.
And the Google Doc is in the chat.
And how would we know which one is filling up?
You should be able to see how many people are in each room if you scroll down.
Oh, I see. All right.
Yeah.
Can't figure it out. How do I get into the room?
It should say join right next to I renamed
I
the
don't see
discharge process.
an option for that either. Oh, like in the Google Doc?
Go to more, the little dots in the bottom next to
I
share
can
Oh, there we
screen.
go. Okay. Yes. Sorry.
It's like I can assign people too if you need help.
Thank you. Sorry.
Oh, you're fine.
Mhm. Oh, on mute.
Looks like we have 9 in discharge process and 6 in the falls prevention.
Are you finding it, Ben?
I'm not.
You're on.
I'm not really quite clear on how to do it. I'd like to go to falls prevention, but how do I click on the link for that group? But if
I
you
can
want
put
to,
you, I'll
that'd be
put you
great.
there.
That'd be
Yep,
great. Thank you.
you're welcome.
I
All
have
right.
this. I have the same issue. I'm not finding how to
Okay, where would you like to go, Kathleen?
falls.
Okay, I will send you now. Maybe I will. Assign to. There we go.
All right, Karen, I just wanted to thank you for having these meetings. I've known about them for a while. I have not been able to add them into my schedule. This is the first one, so I'm Allie from FoodNet. Good to see you in
Yeah.
person.
You as well.
I think that we're going to try to get more people involved with this, and it's going to take some time. But I do believe Lindsay Bullock just joined, and I
Oh.
don't know which one she's in, but I think she's in our client services department. So this is the beginning of this. So don't take our participation. I mean, this is the beginning, so it might not be complete. I have to go right now, so there's something else, but we're going to try to join in over time.
That's
And
perfect.
I don't know, is she in falls prevention or discharge?
She's in discharge.
Okay. We have to even get her a webcam, so we have to get there. So thank you.
No problem. And we'll try to, what I'll try to do is provide minutes from both groups,
Oh, great.
as we're going to have people who are going to want to do both, as well as
Yeah.
people that are going to come in and out probably
Yeah.
of, maybe not be able to do all the time, but might have a specific role at certain.
Yeah. Well, and I believe that the client services department is probably a better, the folks in the department are better participants than me, I'm not doing that work. I'm helping and planning and doing, but not doing it. So I want to make sure it's the best use of time. So thank you for keeping these up, and I'm sorry to have to leave.
No problem. Thanks for popping in. I appreciate
Okay.
it.
Bye-bye.
Have a good one. Bye.
You too.
Hey, Sue Ellen, do you need help getting to a room? Welcome back, everybody. I didn't get a chance to pop over into the falls prevention, but I saw Nicole was there, so and I was excited to hear the good conversation going on in the discharge processes. And I just wanted to make sure that the one thing is make sure you've identified somebody to be your lead so that I can reach out to them and coordinate, as well as you still have access to these documents. So if there are things that need to be added after the meeting, feel free to go and do that. But just wanted to open up if there was any comments or thoughts as you were meeting that we need to talk about before we go today, or even feedback on how the process was.
Just say thank you, Karen, for setting up our questions and our goals. It worked really well. So thank you.
You're welcome.
So great information again. Thank you.
You're welcome. I did want to take a moment to introduce Caleb. I realized that I didn't give an opportunity to do that. Caleb Wilson is a student from Ithaca College, and he's in Elizabeth Bergman's class. And of course, he's going to be one of my favorites as soon as you hear what he's interested in. He's got a passion for health literacy. So
yeah, I think it's a very interesting topic and definitely a big need for all communities. And I was sitting in Elizabeth Bergman's class, and I got the opportunity to be on her research team this semester, and I was thinking something more that I could do for the community. And I'm looking around, I'm trying to find gaps. I'm trying to find something that this community could really need. And I pinpointed on health literacy, and I'm looking around. And I end up actually surveying community members at home, of older adults at home, and I'm realizing that this is a large gap. And I have a future goal within these next couple of years of me at Ithaca College. Me being a first-year student gives me a lot of opportunity to really grow, and a goal of launching a health literacy promotion initiative. I'm not sure exactly. I'm in the very first steps of it, but this has been such a great opportunity to see how this committee talks, to see the deliberative process and all of it. And I appreciate all of your guys' time. And look forward to connecting in the future. I'm gonna put my email in chat if anyone wants to reach out.
Well, welcome to the
Thanks,
group.
Caleb.
You can join as often as you like. Love to have you.
Appreciate your enthusiasm and passion.
Of course, I was jumping out of my seat when Elizabeth sent me the email. I was like, "Oh, somebody who likes health literacy." But it came up in the discussion in our group, and I think one of the things that I've learned with health literacy is, even though I've done these trainings over the years, we're not done. Do you know what I mean? Like, we have to keep doing them. And I think that's a reminder for this group altogether, is that we may have worked on falls prevention in the past. We may have worked on the discharge processes and things like that, but new people come in and out, things change in the community. So sometimes we have to go back to the basics and look at where we're at with that. So thank you, everybody, for being willing to do these work groups and committing to trying to get together on a regular basis so that we can really show something at the end of the year that we've accomplished. So thank you so much.
Thank you, everyone.
Enjoy your afternoon. Stay warm again.